Hey, it's Rita at Gold Medical Jobs, and I wanted to talk to you a little bit today about um, goaling and getting an ideal candidate if you're employing a healthcare worker, or goaling or getting the ideal job if you're a nurse or anybody else in the healthcare field. So here's my 2 cents about that, okay? And my 2 cents is based on a lot of recruiting myself and recruiting for hospitals and recruiting for my companies over the years and being a nurse and working for many, many, many decades. And so it's a conglomeration of that knowledge um, um, that I've accumulated and that I want to share, and that is used at Gold Medical and not at a lot of other zippy places. You know, there's a lot of places that recruit, and you may or may not be aware of all of them, and you may or may not be aware of some of the big ones. And what happens is there's key triggers. Okay, so for example, if you're an RN with a BSN or an advanced degree nurse with an MSN, um, if you're certified in chemotherapy, I mean, so there's certain jobs, whoops, I moved my camera. Sorry about that. Um, so those are key triggers in the online job search and so forth. So Gold Medical works differently. I invite you to check our site, goldmedicaljobs.com, www.goldmedicaljobs.com, and then tune in here. I'm here frequently 2 or 3 times a week. I do a blog every month or so, and also something I like to do. My chair has shrunk. It's not me. Um, it's a broken chair. I need a new chair. And then I usually throw in a little clinical or, yeah, usually clinical Q&A. So I will add a Q&A at the end of this, and I think I'm just going to add a math conversion question. They come up all the time when you're starting IVs, you're giving medications, you're dealing with patients' body weights. If you're in a urgent care, maybe you're dealing with from infants on up to geriatrics. So it's good to have those conversions sort of at your fingertips, and I know you do, and I just do this for review. So look for that at the end of this little video, and I won't be too long. Let's see, I've been on for 3 minutes just sort of explaining things. But what I want to say is it's a great idea. I've said this before. Oh dear, sorry, I meant to turn that off. Sorry. Yeah, so hang on. So sorry. Just such a blabbermouth that I get dry all the time. Okay, so so those little trigger words, when you're applying online and so forth, they're just going to happen. So that's why if you're adding your profile, say you're a nurse or you're a radiology tech or respiratory tech or OT therapist, occupational therapist, or whatever it is that you do, and you want to add your information to Gold Medical so that employers out there can find you, I would say log in as much about you and your talents and your treasures about your job, your the pieces about you that make you sort of stand out. And it could be that you have 10 years in a certain area. It could be that you carry certifications in some specialties that maybe other OTs or RNs do not. It may be that you don't have a BSN, but you're pursuing it. You know, you've already enrolled in college and taking some courses towards that. So the more you add, the better. Okay, so that's one thing. And let's see. For employers, I've said this before, but I'll say it again. Please don't be deterred. If your ideal candidate has 5 years experience in the field, so you're hiring for a surgery center, let's say, 5 years surgery center experience, and your ideal candidate would be flexible with their hours, willing to do early in the morning, 5:30 to or 6:30 to 3:30, 2:30, whatever. Or they'd be willing to do 7 p.m. to 11 p.m., you know, swing shifts. So your ideal candidate is super flexible. Your ideal candidate has their BSN, has 5 years experience, has experience with like surgery. So maybe you do a lot of plastics, or maybe you do a lot of gastric. Let's see. So your ideal candidate, you have all these important pieces that you're looking for, and you need somebody in the recovery room. Okay, so don't be afraid to look outside the box. Okay, so for example, you might have be missing some really fabulous candidates because they don't have 5 years post-op. They have 5 years OR and 2 years pre-op or post-op. And, or what's the other word? PACU, right? Post-acute care unit. So that OR nurse, she flexed. I mean, come on. I was an ICU nurse. I flexed into the OR when they had, back in the day with the Swan scans. Like, the OR nurses didn't know it, the ICU nurses, so in I went. Orthopedic nurses did orthopedic surgery for the most part. That's not to say they didn't do other things. Anyway, so what I'm suggesting to candidates looking for jobs and employers looking for candidates is, yes, you need those triggers. You need to know that your nurse meets your state qualification. A lot of the states now require a BSN, but if it doesn't require a BSN, if it's a preference, then don't ignore the nurses that are maybe working on their BSN, or maybe have they went to a nursing school back in the day. That's where I started, and then I got some college. But you may be missing out on really your ideal candidate by narrowing. I don't know why I feel like I have to use my hands, but by narrowing your scope of candidates by not taking a glance at somebody that maybe has 5 out of the 6 pieces that you're looking for, or maybe even has 4 out of the 6 pieces, but is maybe much more compassionate and kind. You know, when you get to a resume, maybe there's references in there, and you find out that this OR. Okay, so let's pick a job. Okay, so the employer is looking for a flexible full-time plus PACU nurse for their busy, let's say, in and outpatient surgery center. Okay, so it's hospital based. It may be in or next door to the hospital. They do inpatients. They do outpatients. They do run their center from 5 in the morning to 1 a.m., maybe midnight, whatever. Maybe they do on call. so they're looking for a really flexible candidate for their position, and it's a PACU nurse. They want her or him to have a BSN. They want them to be flexible with their schedule. They want them to have 5 years recent experience. They want them to, what else do they want? They want them from an accredited school. They want them to be willing to grow into leadership positions. And what else do they want? Maybe they want them to have some special certification. Okay, so so that's quite a picture they've drawn. Okay, now candidates are starting to apply through a lot of those online recruiters, right? And maybe some of them are halfway through their BSN. Maybe some of them have a BSN that's just missing like one course, 2 units. They're close to their BSN, or something happened. There was a fire at the school and they never got their certificate, so their BSN, they're not carrying their credential with them. So, but this nurse, and then maybe they are, they don't have 5 recent years PACU. When they started their career, it's 2019, so let's say they started their career in 2009, so they have 10 years of nursing experience. The first thing they did was they worked in on a med-surg unit for 2 years. They did nights, then they went to days. They worked in a surgery center, and they just did admissions. So they were pre-op nurses. And then they took 2 years off, so now we're 4 years into their career, their 10-year career. And then they took 2.5 years off and had children. Then they came back and they just worked OR, but they pinched hit for the nurses in the pre and the post-op area. So that shows some flexibility. And now they've been doing that for the last 6 years, but they've been primarily hired and technically are a surgical nurse, right? So I don't know. I would interview that candidate because I saw flexibility. I saw commitment to the surgical realm of nursing. I saw a good, strong start in the beginning of med-surg and doing their time and, taking care of a variety of acute patients. And I saw flexibility. So that would be a candidate to interview. And I would say to that candidate, don't be afraid to interview, pick up the phone, go visit, find out who the hiring manager is. Anyway, that's my 2 cents. Because I believe that it's really, really important to hire the right person. And I think going through candidates, and then I also think I would look at nurses that maybe did some traveling, because that shows a lot of flexibility and strength in new situations. So maybe that nurse was a traveler for a year before she started having, before he or she started having their family, and now they want to stick closer to home. So I would always look at what my manager, my regional manager that I worked with for many years, she always used that term, think outside the box, because we were so fortunate in our hiring by being able to do that, right? Because maybe we weren't the biggest concern on the block, but we had a great reputation, and we kept our staff, both our office staff and all of our medical personnel, for many, many, many years. And I think that's really, that's a strong family, if you will. That's a strong family of people working together. So be patient, don't hire in a rush, and think outside the box, as someone used to say quite a bit. All right, so we're about 15 minutes in. I don't want to take up too much of your time, and it is December the 18th. My gosh, time is flying. So It's very, very close to Christmas, and I am going to make a little Christmas dessert with my dinner tonight. We may or may not have guests, but it's always good to have dessert, and it can go a long way, right? So yes, we should all eat just a little bit of dessert. Okay, with that in mind, I'm thinking that today's Q&A will be a kilogram to pound and or a pound to kilogram. So if you go into your Wayback Machine and you remember that conversion, okay, in America, most of us go by pounds, but in the hospital, we need to be flexible. And in our meds administration and intravenous fluids and specific meds that have to be very finely tuned. And I think of that more and more as I grow old, and my mom is a nonagenarian, a noctogenarian. She's in her 90s. And so I think what works for a 40-year-old might be a little bit different than what works for a 90-year-old. You think? The metabolism is different. You know, their weight is a lot less muscle in many cases. At any rate, it's important to be able to do those conversions, to administer meds, to report to different members of the team, whether it's a surgical team or the pharmacy and so forth. It's important to know those conversions. So the conversion for pounds into kilograms is the pound is equal to a kilogram times 2.2. And the conversion of kilograms is the pound divided by 2.2. So I'm going to give you a weight that I like, that I once was, that I'd like in 2020 might be a goal for me again. I'm not quite there, but I am maintaining. That was my Thanksgiving. My friend Mary suggested that don't make a ridiculous goal during the holidays, but just try to maintain your weight and not gain weight during the holidays. So far, so good. But next year, let's get a little tougher. I'm going to try and take off some pounds. It'd be really good for my joints because they're not so young anymore. Okay, so the weight that I kind of like is 145 pounds. What is my weight? Here's your question, and I'll tell you how I got to the answer. That ideal weight of 140 pounds is equivalent to how many kilograms? Is my weight going to be more in kilograms or less? I'll give you a hint. It's going to be less in kilograms. Okay, like Fahrenheit to centigrade. It's a lot colder at a lower centigrade than it is in Fahrenheit. Fahrenheit, the freezing point is, what is it? 32 degrees? That's like 1 degree centigrade. So anyway, so the question for you, if you're thinking about it, is 145 pounds is equivalent to blank kilograms. Okay, so I'm going to give you 3 choices, and then I'm going to tell you the answer, and I'm going to tell you how we got it. So is the answer 55 kilograms? Is the answer 55.9 kilograms? Or is the answer 65.9 kilograms? According to my calculations, the answer is C, 65.9 kilograms. So I had no idea what the kilograms were, so I had to use the formula of pounds are equal to, kilograms are equal to pounds divided by 2.2. So my kilogram was X, and I had to take my pounds of 145 pounds and divide that by 2.2. I did good old-fashioned division. 2.2 into 145 gave me 65.9. That's the weight I want to be in 2020. Okay, it's always great talking to you. I hope to talk to you more. Tune in to Gold Medical for different healthcare news, for if you're looking for employees, if you're looking to get employed or change your employment. It's a great meetup place for all the healthcare realm. And I'll keep coming to you and blogging and talking and hopefully interacting. That's a goal for 2020. And yeah, I'm interested in everybody, recruiters, hospitals, skill facilities, surgery centers, clinics, all of it. So everybody out there, have a great day. Enjoy the season. It'll be Christmas soon, and I'll check back with you ASAP. Thanks.